Let's take a closer look to the very current topic, hygiene.
Life is full of unexpected challenges that can change our lives forever. COVID-19 is a constant part of our daily lives now, presenting us with new responsibilities. People are keeping their distance from one another, but are still growing closer. Protecting our own health and that of the people around us is one of our key tasks right now. Cutting-edge hygiene concepts can help us overcome this challenge together. That's why the team here at Ottobock works every day to deliver innovative solutions for maximum health protection. For patients, technicians, and therapists. We are standing by your side in times of crisis, while keeping the proper distance, of course. Ottobock. Human, reliable, inventive.
We would like to see the challenges in the daily life and how they can be solved. All of us are aware of the major cuts that coronavirus brought into our life. Hygiene became more important. Supplies had to be reduced to a minimum and enterprises were even closed. Working is now possible again. Erik, you are the head of our patient care centers in Berlin and Duderstadt. How do you perceive the current situation, and did you see any major changes in the whole pandemic?
Yeah, hygiene has been already an important factor in patient care, not yet since Corona. So we are dealing with this topic, and it's our daily life, let's say. We're welcoming international patients in Duderstadt, mostly coming from crisis areas of the world, with unclear hygienic situations as well. So in our patient care centers, we need to protect the employees, of course, but we want to offer our patients a hygiene environment, that they feel safe and comfortable when staying in Duderstadt or Berlin.
So in the run-up to this event, we took a closer look to the work of the patient care center in Duderstadt. Let's have a look to the video.
Hygiene has always been essential in patient care, even before coronavirus. We follow hygiene rules to protect both patients and employees. Patient care is like a contact sport. Patients and prosthetists work closely together, as do patients and therapists. We use a hygiene lock as a barrier between our patient care area and the workshop. In the lock, we sanitize devices coming from the patients before taking them into the workshop. Of course, it's also important that items coming from the workshop are sanitized before they are taken to the patients. Disinfecting patients' area is also essential. They need to be kept clean throughout the working day, because various patients use the treatment rooms, of course. It is important to disinfect the rooms between patients to ensure a high level of hygiene.
So thank you very much for the video, and Erik, we have seen that you have taken measures that we know from everyday life, like supermarkets. Can you explain to us what is needed additionally in an O&P workshop?
Yeah, meanwhile, we're speaking about three important rules for the community. So distance is one, second is hygiene, third is face protection, mouth protection. In patient care, because patient care is a contact sport, let's say, we cannot take distance to our guests, so our patients. So we're working close to each other. For that background, it's important to wear mouth protection, breathing protection. So the patient on one hand and on the other hand, the employee as well. This is very important. Then, like we've seen in the video, we're working with barriers, hygienic barriers, yeah? To have a barrier from one to the other area, for example, from the fitting room to the workshop. In between, we are working with this barrier that we know. Passing this area, the components are clean. So it's important for one and the other direction as well. So coming back to the patient with the device from the workshop, that it comes clean and hygiene, and that the patient knows it. This is quite important.
So hygiene was important before the coronavirus in your patient care centers. What kind of special changes do you need to do in this pandemic?
Of course, Corona made special changes necessary in the workshop. One issue, what's new for us, is to protect the employees under themselves. So, working with mouth protection, for example, breathing protection, keeping distance in the workshop under themselves. This is very important, and working with different teams in the workshops. So have time shift between the working teams to prevent from spreading the virus in the whole team. This was very important. Then quarantine became an issue since we know that we have more and more infections in our environment. Everybody knows. Meanwhile, some friends or family members being positive tested, and when this occurs in the family, for example, then the family members, employees, colleagues from us have to stay in quarantine, for example, until a negative test. So new challenges when working in Corona days.
Thank you very much for your explanation. Sebastian, you as a product manager for Workshop Solutions, how do you experience the time?
Yeah, first of all, we had an increase in demand for all products in the hygiene sector. But what we also noticed was that there's a lot of uncertainty about what measures to take and what to do, because many workshops had to close, or at least had to reduce the patients they treat every day. So they were looking for ways how to come back to patient care and come back to patient care safely. So we had got a lot of questions about this. We already took care, or we already dealt with the topic hygiene before, and we have in a lot of different areas of the company, we are working quite intensely on this topic already. And we're also working with some experts who give us the technical experience in their field to be set there on a good basis.
Okay. Sounds interesting. Dr. Schmelz, you are our expert and you advising Ottobock since a long time, as I know. Could you please let us know something about your work and how you connected yourself with Ottobock?
Yes, I have studied human medicine and engineering, and after my studies I have got special education in medical microbiology and hygiene, and with this special education until now I have an experience of 15 years in these topics, and so normally it is our profession to care about hospitals, homes for the elderly, or praxis, or anything which is connected with medical treatment and medical support and patients. And here we want to reduce any risks of infection, and we want to do it with breaking infecting change. This means we want to prevent to get the microorganisms from A to B and to struggle the chain, and so we have an impact about risk reduction in form of infectious diseases. This is what we do. And for this we use different tools. One strong and important tool is disinfecting, because disinfecting means to set a surface or a thing in a condition which is not infectable. This means asepsis. And in this way we have developed some processes for Otto Bock Incorporated. We have started this process in 2009, and since 2009 until now we have developed a lot of topics in this direction, in the direction to prevent infections, to reduce risks, and to give more safety for the colleagues of the company and for the patients also.
So you're working since 2009 with Otto Bock, and especially for now, how do you perceive the situation around the topic hygiene?
For me as a professional in this topic, it is not so untypically, because now everything is said and said out, which we have said before already. And now we have another recognizing in the community about this theme. This is positively to see, because now we see a little bit of respect against microorganisms, but we see also respect about procedures and methods to reduce the risk. For example, hygiene procedures. This is now formed in the community because this was not seen in the last years before. This was a big problem, and now we have open doors, and now we need to set the correct process and proceeding to make this better.
Okay, you're talking about respect, but we don't have to be afraid, is it right?
No, okay. This is a big difference. Afraid means this you have when you have no knowledge about this. Okay. Then it's a big black box, and then you are afraid what's inside and anything. But with knowledge, you have not to be afraid. When you have knowledge, you can see the things logically, and you can form a structure. And with this structure, you can find solutions for the problems. And one solution is a special disinfecting process. And this disinfecting process also we have formed for Otto Bock for the company.
So I think now is your part, huh, Sebastian? We're talking about a special process. What do you do for Otto Bock, or especially for the customers?
Yeah, so when this pandemic started, what we did was looking into the day-to-day work of our own patient care facility, and see what are the challenges there and what they need there to do their work and to do their work safely. And then I already mentioned there was a lack of information, so we created posters, for example, what we saw in the video of the patient care facility, but we also revised our product portfolio. So we already have products in our portfolio as a room disinfection unit, which we can see in the background, to disinfect the room air and to disinfect the room, and a really in-depth disinfection. But we also added new products. For example, we have this hygiene station here, which serves as a hygiene lock, what Erik already explained, what they're using in their patient care. But there are more problems. So for example, that you have a lot of people, or people need to be in the patient care. You have to work with the patient, directly on the patient, and so there is this contact. So you need to find a way how you can reduce the germs or the contamination in the room air. And yeah, with the help of Dr. Schmelz, we found a good device which can help with this innovative plasma generator.
So the device is now the key. Dr. Schmelz, can you explain us how is the device working?
Yes, this is a plasma generator. This device forms hydroxide radicals from oxygen from the air by an electrical decompositing process inside of this. And the hydroxide radicals are strong against microorganisms, and they destroy microorganisms, but they do not affect any higher organisms like us or animals or plants. It is only working selectively against microorganisms. And you see, this is a ventilator, and the air is conducted through this device. And so it is clear that we have an airborne microorganism which is aerogene transmitted, this coronavirus. And with this device we have an opportunity to reduce the risk of infection by disinfecting the air in place. And this is the interesting aspect with this device, because other processes like aerosol disinfecting processes with hydrogen peroxide or other peroxides which are dispersed in the air are workful, of course, powerful, of course, and has a high impact. But the problem is that the room must be empty and nobody must be inside. And this is only usable for shock disinfecting. Okay. But for continuously disinfecting processes, this is not possible to use. Okay. But plasma generator is usable because hydroxide radicals are not affecting any human beings or animals or plants or anything, higher organisms, but they are very strong, working against microorganisms, especially viruses, and so it is a probed way to eliminate microorganisms from the air and to reduce the risk of transmission of aerogene microorganisms and the affected diseases.
So I have a personal question, and I think our viewers would like to know that as well. How many devices do I have to use? Is it based on the size of the OMP workshop I have, or how is it working?
The question is to see independence of the volume, of the air volume of the room. And for example, when you have a room with a square area of 60 square meters and a height of 3 meters, you have a volume of 180 cubic meters inside of it. This device is usable for 120 cubic meters in a room. And when you have 180 cubic meters, then you need a second device. Also this can use it additionally if volume of air in the room is too high.
Okay, thank you very much. Sebastian, seeing this device, and seeing into the future or waiting for the future, is there anything else to come? Would you like to share some more information with us?
Yeah, so we're still having own developments, working hard on this, but also have some cooperation in which we will have some results in the close future, where we will present new products to our customers.
Okay, new products. Can you tell us more about the new products? Is it allowed to say something?
Yeah, for sure.
Okay, thank you.
For example, we will have a device which is also there for cleaning the room air. So the air in the room, and it's able to kill viruses, bacteria, but also, for example, gases or also odors. So you can also make the room air, this takes the smell out of the room air. And the great thing about this new device is that it has a really quick result. So after you turn it on in a short amount of time, you can get the room air cleaned. So really quick process. And for this device, we're working together with a company called Calister. Okay. And this company is coming from the medical clean rooms, which are used for surgeries. And they now developed a device, a smaller device, but which perfectly meets the requirements that we have in our OMP workshop or patient care facilities. So we're really happy that we will be able to offer this device in some time.
So Sebastian, we can be curious what's coming in the future. Thank you very much to our guests. Thank you very much for your participation here in the expert talk. We are very happy that we are connected as a team and helping each other. So thank you very much for the viewers, and we wish you all the best, and please stay healthy and have a look to the other expert talks. Thank you very much. Bye-bye.